Cheers here. Good morning, everybody. And thank you for joining us here today in the John A. Wilson building. And we are here to talk about health care in the District of Columbia. And I think that we all assembled agree that the district's healthcare system is at a critical juncture. And while our city is resource rich in the kinds of health care we offer our residents, utilization of and access to those resources is neither equal nor equitable. Our city has 7 acute care hospitals, some of which offer world-renowned services, but each face incredible demands on their emergency rooms at any hour of the day. Every day, we work to make the city a great place for families to grow and thrive, yet being pregnant in neighborhoods east of the Anacostia River mean that you're at least 20 minutes away from the nearest hospital to deliver your baby, or it may also mean that you have limited options for OBGYN specialists. Our population is more insured than 48 states, with nearly 40% of DC residents paying nothing for medication, appointments, and procedures. Yet the spectrum of health outcomes for far too many of our residents do not reflect how very much we invest in our health care. So today I am announcing that we have established a new commission, a commission on healthcare systems transformation that bring together the best and brightest in the government and private sector and our nonprofit sector that deliver healthcare services to the residents of the district. The commission is going to facilitate partnerships between the district and the people who do this work in planning and delivering services each and every day. Our hope is to work diligently to create solutions, and the people who will participate in the commission are ultimately responsible for implementing those solutions. So together with members of the commission, we commit to dive deep into the day-to-day operations of our health care system across the city. The commission will examine and provide recommendations on how we can improve the district's health system capacity, increase access to services, including our emergency rooms, behavioral and mental and maternal health services, and remove barriers to careers in health care. So this morning, I am proud to announce the co-chairs of this committee, as well as the members of the committee. First, we will have 2 co-chairs of the committee. One could not be with us today, but the co-chair who you all know, who will help us lead this work, is former at-large council member David Catania. And many assembled also know the President and Chief Executive Officer of the Catholic Health Association of the United States, Sister Carol Keenan, will also serve as a co-chair of this commission. So during the 8 years that Councilmember Catania chaired the Council's Health Committee, he was widely credited with leading the transformation of the district's health care infrastructure. David is well-versed on publicly funded health insurance programs and played a major role in cutting the number of uninsured individuals in our city by half. He has also authored legislation to create the DC state-run health exchange, which was one of the first and most successful in the nation. And now I'm confident that working with Sister Carol Ann and the 25 members of this commission, David is going to continue to help us transform the way Washingtonians access the youth of health care in our city. He will be joined, and you will have a chance to get to know all of the members of the commission. But I will say that we have 5 representatives of the acute care hospitals in our city, 3 representatives of specialty hospitals, and 5 community representatives that include our nonprofit community healthcare providers, in addition to several ex officio members that include members of my cabinet who are involved in how we plan and support healthcare delivery, as well as Council Member Vincent Gray, who chairs the Council's Committee on Health for the District of Columbia. Thank you, Council Member Gray. So with that, I am pleased to introduce Councilmember Catania, and then I will take questions, and then we'll sign the mayor's order. Thank you, Councilmember.
Thank you very much, Madam Mayor, for this distinguished opportunity to chair this commission. Chairman Gray and other distinguished members of the soon-to-be-formed commission, and ladies and gentlemen, it is a real honor to be able to come off the bench, so to speak, from the private sector. When the mayor asked if I would do this, I think I got yes out of my mouth before she finished with the question. Look, this is our family. And as the mayor mentioned, about 40% of our family, 275,000 of our citizens, rely on the city for quality health care. And we have done, I think, some very, very positive things over the last 20 years, and there's still work to do. I want to be very brief, though, and leave you with a few statistics that I think these statistics have to define our work. The disparities in life expectancy is the most simple and the most inelegant way to distinguish between what it's like in this city if you are of a certain race. If you are a white woman in this city, you have the longest life expectancy in America. You live on average 9 years longer than African American women. If you're a white man in this city, your average life expectancy is 83. If you're a white woman, it's 85. For a black man, it's 83 years old. And that is 15 years longer than an average African American male. Your average African American male in the city is dying right at the time he is eligible for Social Security. So this is not about just health care and our loved ones. This is about wealth transfer. This is about what is right and what is wrong and what we can do better. But Mayor, I'd like to just, if you don't mind, use one further illustration. For those of you at home who thinks, gosh, I'm insured and I'm in the privileged group and therefore this doesn't impact me, I'd like to take a moment to give you an illustration of how it does. Last month, we had a medical emergency in our house. I've never met an English Springer Spaniel that I didn't love. I can't say the same really about people, but English Springers, I love. That was for you, Wayne. So in bringing another one into our house, my older one, Hunter, decided to take it upon himself to work out his anger on my husband, Bill, and bit him on the hand. Now you think, gosh, how serious could it be? 3 days in the hospital, blood infection, serious. So when we go to the hospital, the one closest to us, Sibley, a hospital that many in the city associate with no delays and quick access, we were behind 5 ambulances. This was an emergency. The point is, no matter where you live, if there are shortcomings in our system that come about from a closure of Providence on the other side of the city, it impacts all of us. And if you think it doesn't, I want to really encourage you to think again. And so our work here is to work with the mayor and the council and all the institutions to give our family the best health care we can. In closing, since I left the government, I've been doing public affairs around the world, and I've had a chance to see public run systems in the UK and just a whole different variety of systems. What we have that virtually no place else has in this country, we have twin advantages. We have the moral understanding of the obligation in front of us and the resources and willingness to address it. Those are blessings. And so, Madam Mayor, we hope to make this commission something you'll be proud of and that will redound to the benefit of our citizens. And so we can start, putting those health inequalities that exist today on the trash heap of history in the future. And so I want to say again, thank you, and what an honor it is to serve with so many distinguished men and women. Thank you.
Councilmember Gray, before I go to questions, would you address the group? You good? Okay, I'll take that.
Thank you very much, Mayor. I want to congratulate you on bringing together this distinguished group. I think we know some of the extraordinary challenges that we have in the District of Columbia relate to healthcare. I often talk about the fact that the further west you go in the city, the more blessed we are with the services that we have. The further east we go, the greater the challenges are that we have. So you have assembled an extraordinary group of people who I am proud to have worked with for some time. I congratulate you on the chairs who will be leading this august group, and I'm hopeful that we will have a report very soon that we can then go forward working with your agencies and be able to effectively implement. I look forward to the day when we can say that health disparities are a thing of the past in the District of Columbia. The health systems report that you released a number of months ago, the work that's been done in the past months, the work that we're doing to try to be able to move forward some of the ambulatory health services, some of the acute care services, I know will benefit tremendously from the work of this body. So I know, as the person representing the council at this stage, the person who works on healthcare now almost daily, the person who I had a chance to work with, Councilmember Catania, during his time as the Health Committee Chair. I'm absolutely certain that we're going to bring to bear the resources that are necessary to be able to solve this problem. So thank you very much for bringing this group together. And I certainly look forward on behalf of the Council's Committee on Health in working with the body that's been assembled. Thank you, Madam.
So I should also note that our lead staff member to support the commission will be Deputy Mayor for Health and Human Services, Wayne Turnage, and his team. So thank you, Wayne. And I want to acknowledge that we've been joined by members of my senior team as well, City Administrator Rashad Young, Chief of Staff John Falchicchio, and my Senior Advisor Beverly Perry. Okay, question, Sam?
So I heard your number, 40% of the people don't have to pay anything in DC. This is not one of those states where they, didn't accept the Obamacare essentially. So if that's the case, what are your ideas as to why it's so bad?
Well, I think that we, in a lot of ways, we have great opportunities and resources, and we have to work even harder to make sure more of our residents are taking advantage of those great opportunities and resources. Now, to the extent where we have access problems, where people have limited access to specialists or to emergency room care, mental behavioral health care, maternal care, the commission is going to be addressing those access issues. Now, one very important thing is all of the folks behind me represent the healthcare system, and they have tremendous planning resources to bring to bear to this discussion, along with the tremendous resources that we have in the district government. So we want to put all of those people around the table to work on those specific questions.
So people have access, but they're just not going in?
People have insurance, and I think you know this, Sam. We talk about this statistic. You're sitting right behind our fire and EMS chief. And one thing that we know is that people will call 911 before they call their primary care physician. So that person who may have an emergency or who may not actually will end up in an ambulance and in one of our emergency rooms. Okay, and so what we need to make sure that we're as part of this discussion is making sure that we are too getting people the right care when they need it. Yes.
Mayor Bowser, so much of healthcare is influenced by federal government policy or market forces and business decisions made by hospitals. What kind of powers do you have that you want the commission to focus on? Like, what kind of policy areas that are within your control do you want the commission to be focused on?
Well, I think you missed the point if you're talking about my power. okay? Because my power, is one of my powers is the power to convene people who are part of the solution. So the government can't fix this alone. So we need to talk to all of the people in businesses, and you're right to point to businesses, but also nonprofit entities that are providing health care to see how we can work together on these solutions. What the government can do in a number of ways to influence decisions is to look at how we fund different things, and Wayne's team has a number of strategies that they can bring to bear. But we don't want to do that in a vacuum. We want to talk to our systems providers. Now, they talk to each other. I don't want to give anybody the impression that this is the first time we've met, because right, we talk all the time. Why are you laughing? Yeah. We talk a lot. But we are going to focus the discussion on a few specific questions. Yes.
Just to the membership, and actually this is to Councilmember Catania, I know that in your current day job, you do represent Sibley and Unity, and I don't know if any other members have representations of healthcare provider companies. Does that become a concern at all as the commission works forward?
Well, I think, and we certainly have examined that question, and we can't have this discussion without interested parties. So what we will ask each member to do is make a disclosure of their involvement, so that's front and center for everybody to see. And if there is some discussion or vote, then that member will be asked to recuse him or herself.
Mayor Rouse, can you tell us what this means for the discussion and going forward for the hospital situation east of the river?
Well, it's bigger than that. So we are talking, as I mentioned, about access to emergency rooms across the city, access to behavioral and health across the city, maternal health, and the capacity of our system, including a hospital on the east side of our city, but also specialists, and making sure that our primary care system is supporting our residents where they need to be. So it's certainly bigger than the question you asked. Yes.
Mr. Boucher, can you respond to the audit on the Housing Production Trust Fund? And what do you say to residents who are concerned that they see this is the biggest vehicle for addressing affordable housing, and the lowest scoring applicants were chosen in favor of over higher scoring ones?
I think what you'll find, Fennett, is that all applicants were funded in various rounds of the Housing Production Trust Fund. And what I would say to the residents and to the council is that the Housing Production Trust Fund needs more money, not less. Because the truth is, if we weren't so limited in the amounts of awards we can make in each round, more people and more organizations would be funded. I would also make sure that people kind of read carefully and understand that the director of DHCD makes decisions based on what she thinks is most viable. Yes.
Hi, I'm Lauren Beal with DC Greens. I'm just noticing a lot of folks here are working with clinics that have started to integrate the city's produce prescription program into their care, and
Good.
I'm wondering if this commission is going to be also looking at integrating sort of social determinants of health interventions that could be driving more patient utilization of the system as well.
I certainly think that there's probably some intersectionality with those discussions. You do know, too, that we have a Food Policy Council, and the Department of Health also, I think, has several commissions that talk about how food impacts health. So this won't be a commission that can ask and answer every question. I do want to be clear about that, but clearly there are professionals and experts here who will bring questions like that to bear.
Mayor Bowser,
Yes.
Tomorrow the council is going to consider legislation on medical marijuana and how the legislation impacts DC government employees, and the fact that many DC government agencies have different policies in place that don't seem to all line up with one another. What are you doing overall as far as making available to DC government employees something that you wanted to make available to every DC resident?
What I want to make our system make sense, and that's if you're talking about what we're doing for recreational marijuana, what everybody should recognize is that government and private sector employers can make decisions about employment. Okay, and so that has been our situation here in DC government, as well as safety sensitive positions being subject to drug testing. So I've asked my team, so we're doing a scan of policies and procedures that we know that we can find out about across the nation and figure out what makes sense. We still have a tremendous responsibility, as you know, in our safety positions to make sure that people are safe to operate vehicles, firearms, and the like. And so we will continue to put the best policy in place.
Specifically with medical marijuana, why should this be treated any differently than any other prescription? You have employees who are probably prescribed Vicodin and other drugs.
And they're not permitted to use a heavy vehicle either. So it's
So you know what officers, what DPW, what DTOT employees are actually prescribed?
no, I don't.
And you don't, well, so why are it seems that these individuals who have self-identified to the government are being treated differently than people who are prescribed other legal drugs and have been told, and what is the policy? Will they lose their jobs if they have a medical marijuana card and have been told that they're not allowed to avail themselves of medical marijuana?
We, for our safety sensitive positions, Mark, we haven't changed any of our policies. Those policies are under review, and should they change, we will let our employees know.
So are they in danger of losing their jobs?
Our policies haven't changed.
Well, what is that? What is the policy?
The policy is if they, and I don't know who you're talking about or what type of positions.
There are DPW employees who drive vehicles who have been given apparently 30-day notices that they're not allowed to be using and they have to find another drug to take. Why is this one drug that you have legalized for medical purposes being treated differently than every other drug that they could avail themselves of legally?
As I said, we're reviewing all of the policy citywide, but we do have a focus on making sure safety-sensitive positions are safe.
And so are these employees in danger of losing
That's all
their
I
jobs?
have to say. Any other questions? Yes.
So I just came from the briefing with Chairman Mendelson talking a little bit about the budget. One thing that came up was the issue of sports wagering revenue and what that was going to be spent on. The council initially, when they legalized sports betting, essentially promised that it was going to go to either birth to 3 and violence prevention program, kind of split somewhat evenly. Then there was a debate as to whether that's the best use of revenue, but now it looks like none of that revenue is going to be dedicated. What do you think? What would you say to residents who assumed that sports betting revenue would be going to these 2 specific programs and now might be finding out it's just going to the general fund?
Well, I would say a couple of things. First of all, I think in the council's initial vote, there was some question of whether all of the revenue coming in for sports betting was dedicated or whether it was the amount going to the specific new facilities. And so it was a much smaller amount than many people thought to start with. And then I would tell them our proposal to the council actually went way above what those revenues would be in terms of the investments that we made in the violence interruption program, in the different birth to 3 or early childhood programs. So I'm not sure where you're going with that.
I mean, residents may have thought, who may have concerns about sports betting coming to DC, they assumed, well, as long as the money gets spent on education for kids.
Well, it's actually more money being spent than would be coming in through the legislation that the council passed. So if that's the concern is the money's not being spent on those programs, more money is being spent. Yes.
Now that I'm here.
Okay.
Last
Good
one.
to see you.
So we're a month out from the 4th of July, roughly. And I know my colleague Mark asked.
Mark, do you want to take your question?
Any updates over the weekend from the administration on the new
Am I
plan?
missing something here about an update that you all know about? So the 4th of July is going to happen on the day after the 3rd of July. So that's news. I promise it's going to happen.
Is it going to be greater than it
And
was last year?
say again.
Is it going to be greater than it was last year?
I hope so, yes. I hope it gets better every time. In all seriousness, our job is to make sure that we welcome visitors to the city, our residents, and that everybody has fun and gets home safe. That's all we think about each and every year. In addition to that, we're making sure that all 8 wards of the city are safe. So you'll see a lot of our police resources and fire and EMS resources downtown, but we're also policing and taking care of public safety issues across the city. So that's how we walk into preparations for the 4th of July. It's clear that there's been a lot of discussion about what will change. And let me also make this point. We, the District of Columbia, do not produce the fireworks. It is not a local event. It is and has always been an event produced by the National Park Service, part of the federal government. And so they will continue with those plans. We support it, of course, from a public safety and movement standpoint. The president will deliver a speech, we're told, and I am also told that they will move the location of the fireworks. And beyond that, I don't think that we have another update. Now, Director Rodriguez in the Special Events Task Force, and there are a number of members of the Special Events Task Force who are here, have those kind of day-to-day conversations with our federal partners. But as soon as we know more about the speech, I assume that that's still on and that's going to happen, how it's ticketed, what roads will be closed, and where the fireworks will be. I think that's an important thing too, because we may have other road closures. So I think that we plan to have a safe event. We were at another event where Metro will adjust depending on what is needed for the new locations for fireworks and a speech. And we will, as we do with other special events like this, we will submit our cost as part of our federal request. Thank you, everybody.